could just follow up on that, I'm more than happy to give you a list. It will cost you money. Can I have a commitment from you that you will spend money on Pan and Barton at a serious level to start addressing these issues, in particular the concerns regarding housing, which also, I have to say, applies to Ryde North East B LSOA, where there is also a very desperate need for affordable housing in that town as well as within Newport. Thank you.
While I can't guarantee you any huge amount of spend, I will do my best. Please send me that email with the details of how you think we can help. Thank you.
Leader, could I just respond? Thank you. So it sounds like you were having to leave before the item, but we've developing a health and wellbeing strategy, and we want to focus on the areas of most need. So that'll be part of that discussion, not about money, but that's really important that we address inequalities, and that's what we'll discuss later.
Okay, not just a talking shop, Jeff. We're going to do things. Thank you. Okay, so we've had no public questions. We brought that through the members' question early. So we move on to item 4, which is the chairman's update. And as this is the sort of first meeting that I've had to chair, I'm going to pull in my chief exec, John, to give an update.
Thank you, Chairman. Normally 3 things to cover in terms of Chairman's update. Firstly, actions from the previous meeting, which I think you've already discussed. Secondly, live issues for the board to be aware. And I think perhaps the livest issue, or the most alive issue, is that to note that the Health and Care Bill has now had its second reading in Parliament on the 14th of July. The outputs of the bill that are going to impact on the work of the board to quite some degree, I think. So just in summary, the bill is going to allow the establishment of new integrated care systems to bring together providers and commissioners of NHS services, local authorities and other partners to plan health and care services to meet the needs of their population. We're going to be part of the Hampshire and Isle of Wight ICS. That's already operational in shadow form and is expected to go live from April 2022. The bill does expect that much of the work of the ICS is going to be delegated to a much more local level based on the concept of place, and that's generally acknowledged as being the upper tier local authority boundaries. So the Isle of Wight will be a place in the concept of the Hampshire and Isle of Wight ICS. It's yet to be seen, and it's not really clear in the legislation how the ICSs are going to work alongside health and wellbeing boards. It's also interesting to note that health and wellbeing boards are also required to improve the health and wellbeing of their local population and reduce inequalities. So we've now got an ICS that's charged with that, and the health and wellbeing board that's charged with that, but without any way of working out where the boundaries fall between the two. The bill will also provide for the Care Quality Commission to come and inspect the delivery of adult social care service as well. So that's a return to something that CQC used to do a number of years ago. I think this might be something we want to bring back to a future meeting of the board, Chairman, as things start to work themselves out. So in terms of live issues, that's the live issue to bring to the board's attention. Third item of your announcements really is for any extraordinary issues that members of the board may wish to raise not already on the agenda. And I don't know, Chairman, whether or not Maggie Oldham from the NHS Trust just might want to update the board in respect of the recent CQC inspection. Okay. And I don't know whether at this moment, it's probably a bit soon, but Sarah, whether there's anything you want to say about the beating crime plan that was published earlier on this week, or it's possibly a bit too soon for that one.
Yeah, thank you for that opt-out, John, because I think it is too soon at the moment. More detail will be coming, I've no doubt.
Of course, thank you. But perhaps
okay, can I bring in Maggie Oldham to give us a quick roundup of the CQC visit, please?
Thank you, Laura, and thank you, John. Apologies, I didn't realise the meeting.
Hang on, Maggie, we can't hear you here. Try again.
Hello, can you hear me now? Can you hear me now?
Yes, we can, Maggie.
Okay, so thanks, John, and thanks, Laura. And apologies that I'm not with you in the room. I didn't realise this meeting was now going to be running in a public, in face-to-face, so apologies. I am very pleased, Laura, just to have a few minutes to talk about the CQC visit. Some apologies to those members who have heard this news already through the ICP meeting yesterday. However, we have now had our 2 inspections from the CQC. One was to look at 5 of our core services, and the other was to look at our management arrangements, the well-led inspection. I'd just like to start by saying for context that this inspection period was carried out while the CQC are still in their pandemic framework, which means that they have not been allowed to do routine ratings inspections. What they have been able to do since February is visit trusts who are rated either inadequate or requires improvement, like ourselves. Those visits have been predominantly to assure the CQC that there's been no deterioration since the last visits. They have, throughout the pandemic period, visited trusts if they felt that safety or quality was being compromised. And I'm very pleased to be able to update members that throughout the whole of the pandemic, we weren't subject to a visit of concern. We did undergo a infection prevention and control visit, which was the same for all organisations and for which we were rated good. So the 5 core services were visited over a week period, and we had 30 or so inspectors on site with us. And that was during June, and then a week and a half ago now we had the CQC back to do virtually to do our well-led. I've had a letter from the CQC which they've asked me to share with our board in public, but also with our staff. So as I've done that, I think it's a nice opportunity to update yourselves. There's only half a dozen or so bullet points that I just want to bring to your attention, and I should get the full report. The full report should be published for everyone to see in September. So at a subsequent meeting, you will be able to see a whole report. At the moment, I just have a highlight letter from them, and the following bullet points are in that. So an overview of the feedback. First bullet point is, it's clear that progress has been made in the trust. You're on a journey and have plans for progress and the will to take this forward. Continued system and partnership working are essential to ensuring the sustainability of the organisation moving forward. Some strengthening of governance in the organisation, building on risk and information management, is still needed. The ability to use the current strategy refresh through the system and partnerships is an enabler to move forward. The culture, enthusiasm and energy for patient care was palpable, as well as that for staff care and wellbeing. This was throughout the well-led and the core service aspects of the inspection. Engagement with staff, patients, partners and the system are much improved, and there is evidence that you've used the support given for the improvement and benefit of the island. So that was the highlights that we received. We also, in the verbal feedback, heard, I'll just read you this, not as fancy as a letter, just what I jotted down on a post-it note. But what they told us during the verbal feedback for the visit to the core services, which means an awful lot to us, because the specialist advisors are people like ourselves from practice, who can really know and judge against other organisations. But we got told that the inspection team saw dignified, considerate and bespoke care, and there were no patients about whose care the CQC was not confident. So overall, Laura, it was a very good inspection. I've shared with colleagues before, there's often a big jump between the verbal feedback and what you see written in the report. But now we've had the letter that they've asked me to share, I do think that we will see a report this time which shows the progress that we've made. And of course, it means all the more to us here in the Trust. And I know ICP colleagues were sharing the same sentiments yesterday, because what we've been able to do is show improvement through the pandemic. So again, I absolutely believe that the reason we've been able to improve at the rate that we have is because we've worked together as a system. At the moment, our performance for emergency flow is the best in the region for the South East for acute providers, and we've been maintaining that position for many months. I think, again, that's a credit to the work that we've done through the health and care plan, and the work that both Carol's led on in social care, and colleagues from CCG and health have been committed to across the broad agenda of what we've been trying to deliver. So whilst it's good news for the Trust, I also want to be absolutely clear that in my view, this is success for us as a system as well. So that's all I wanted to say, Laura. Thank you.
That's absolutely superb, Maggie. Thank you very much. And that was actually a better update than yesterday. Funny enough, there was much more in that. So well done, and well done to all those staff. You know, everyone's got lives, everyone's got things going on, but they've managed to keep the hospital open, which is absolutely exceptional. So our thanks to all the staff for that. Thank you. There's just a couple of bits on the paper, page 8 of the previous minutes, that I just wanted to question, because this is where we raise it, and that's about the Sharon service, the 111. Could somebody confirm that that is still live and it's still working and it's being promoted, please? Page 8. Anyone? Well, if somebody can come back to me on that, and there were plans for a cafe-fronted service in Newport. Obviously, during the pandemic, that probably didn't happen, but is it going to happen? And could I have details of that, please?
Laura, it's Maggie again. Can you hear me? I'm not sure if, can you still hear me?
Yeah, we can hear you, yeah.
Oh, yes, as to the very best of my knowledge, all of those plans are still on track. We're very pleased with the progress that we've been making, but we will confirm that after the meeting for you formally.
That's absolutely superb, Maggie. Thank you for that. It's just such a vital service. Thank you. Councillor Lilly.
I just while we were on mental health, and from the minutes of the last meeting, could I ask Maggie a question of the progress in the mental health services on the island? Because there was actually quite a lot of development, and also were they involved in the CQC inspection recently?
Thanks,
and how did they do?
Thanks, Michael. And yes, they were involved in the recent CQC inspection, and that feedback that I've given you covers all of the services that were looked at. So that was mental health, community, acute services, but yes, it absolutely covered mental health. I'm desperate to see the report, because again, the verbal feedback that we received for mental health was most encouraging. So we've still got work to do. I don't try to profess that everything's perfect. It's not. In fact, perfect's the enemy of good in my book. But we absolutely are demonstrating from a mental health perspective that we really are improving the services. And I missed the first part of your question. I'm sorry, Michael.
It was just the, I think you've answered it, because my particular question was about the CQC, but it's good. I just want to point out that the Isle of Wight Council has appointed me as the mental health champion, and I would, like to, probably have a talk with you and Leslie Seasons early on, so that we can actually look at that. Thank you.
Yeah, well, you're most welcome, Michael. We've worked closely with you over the 4 years that I've been here. So yes, I'd love to extend a very warm welcome to you, and I know Leslie will be the same.
That's superb. Thank you very much. That's moving forward, so that's good, Michael, if you could take that forward. Okay, so I move on to item number 5 of the agenda, which is the COVID-19 update. I think that's you, Simon.
Many thanks, Chair. I'll just give a quick update as how to show how the pandemic's developing. So we are in a third wave of infections. It's really important to kind of distinguish between waves of infections and waves of hospitalizations, because they're slightly different, and that relationship has been not completely broken, but in the main it has. So our latest figures that I've got this morning, our 7-day rate is 232 per 100,000. But our over 60s rate is 61 per 100,000. So that's the new cases in the last 7 days. And that's really important, that we're not seeing that increase as much in over 60s, because as I said, the vaccination programme has broken that link to a certain extent. It is really important to remember some people are still going to hospital. We are still seeing a small increase. In the main, not completely, it is people who are unvaccinated, but there are exceptions to that, particularly as we're preparing for the booster vaccination with older people's immunity waning, because an immune response in an older person may be weaker than someone who's young and fit. So we're just working through that. But I think what I can say now is our rates are not going up quite as fast as they have been. They're still going up, but not as fast. And so that's good. Our highest rates still remain in that younger population of 20 to 24s and 15 to 19. And those who are in meetings yesterday, we talked about how we really need to promote that. And I think we are doing that on social media that perhaps people of our age probably wouldn't see, because TikTok and Snapchat, but I'm not going to cast aspersions on your social media habits. Our positivity is again quite high, over 5%, and we know that means that the pandemic is spreading, so it's 6.4. With regard to the vaccination programme, great for colleagues, particularly Michelle and colleagues in the NHS, we have 75% of the population is totally vaccinated. That's really good news. A couple of other updates, that's right, Chair. Just to say, you've seen a lot about isolation guidance, and that's changed an awful lot in the last few days about people who don't need to isolate their contacts. It's in very specific, exceptional circumstances where that can take place. And I was talking to colleagues of Sarah's over the weekend about where that lies, and it's for particular groups of people. So I think there's been a lot of noise about it, but it's not actually quite what people may perceive. Finally, I want to talk about contact tracing. That's still going on, a really important thing we do. So there's the ping that people are aware of by the app, but actually the formal contact tracing that the team in the Isle of Wight Council do in conjunction to National, that's still going on. We picked up the schools contact tracing from Saturday just gone, and we'll be carrying doing that. And I want to assure colleagues we are really preparing for autumn with schools, doing a lot of work to get them ready for to kind of what's going to happen in the autumn, how we're going to manage that. There'll still be cases, but actually it's likely that contacts won't need to isolate of younger children, but we just need to prepare for that, alongside the fact that we're going to have the flu vaccination for all age children, which is new, because it used to be for 0 to age 2 to age 11, and now it's going up to age 16. So we're working closely to make sure that works and doesn't disrupt education, but a really important thing. But we're not rolling out, I say we, nationally, they're not rolling out the COVID vaccination for children, except for those who've got clinically vulnerable conditions or who are living with someone with clinically vulnerable conditions. Chair, I'll stop there, but always happy to take questions.
Okay, are there any questions? Councillor Michael Lilly.
Firstly, Chair, I'm here representing as the Isle of Wight chair of the chair of the Isle of Wight Voluntary Sector Forum. Simon, thank you for that report. I'm really concerned because seeing on the ground and picking up, a lot of people are being pinged. There's a lot of isolation. There's definitely a lot of isolation of Isle of Wight staff that I know of. I know a lot of employers are actually having difficulty with staff. I'm sure Norman can say more about that, because so it seems to be quite an issue. And I'm also picking up that actually, people obviously have COVID, because that's essentially the thing. So even with the rates, definitely people in their homes, I think they're not necessarily going to hospital, but they're definitely in their homes isolated. And I just think that we need to be sort of targeting people, because people are finding, I think, this stage of getting a ping really difficult. This stage of isolation, this has been going on a long time, and people are, I think, losing steam, right? I'm definitely, as a ward councillor, getting quite a lot of people saying, actually, I don't know what to do now. I've been doing this for 18 months, on and off. I think one day it's okay, and then suddenly, next day it isn't. We're back to square one. So I was just helping a family early this morning who are all isolating. And they were ringing me up saying their elderly residents couldn't get food because they were isolating and they couldn't get to them with it. So,
You have a question?
well, my question is what do we do about it, Simon? Because we do need to I think, particularly through our community hubs, which are still there through the voluntary sector, within that. Thank you. I've got another point to come back to, Chair.
Thank you, Councillor Lilly. So I think the first thing is people are getting pinged because we've got more infection. So actually people have got more contacts and we're out and about more. And I think that's probably the other thing that's causing frustration, that previously when we were, if you were a contact, well, everyone was kind of at home anyway and not able to go out and about. Whereas actually now you're seeing your friends and family think, well, I wanted to go to that barbecue and I can't go. So I think we're seeing that frustration build, but it's really important that we realise they've been pinged or contacted because they are a contact of a case, and the way we're going to stop this pandemic spreading is by isolating people, and that is changing after August because more people will be vaccinated. So you're right, and we've got the COVID helpline still. People can phone that up and get help from the council. So we've still got those things in place, and when we phone people up to say you need to isolate, we offer that help. So if we need to do more, I'll connect with Chief Executive and Deputy Chief Executive is doing that.
I can add to that as well, that people who go and get a PCR test at New Close will also get a leaflet with all of that information on, so they should be able to share that information with their families and any close contacts that are self-isolating.
Welcome, Alison. Can I bring in Councillor Ian Stevens? You had a question?
Yeah. Simon, your report on page, I think it's 19.
We haven't got that far yet. We're on COVID update,
Yeah.
which is number 5.
Well, we'll wait then. But I'm interested because it's all part of the COVID update. Is the support that we are providing or could be providing to our young people who've been affected by online abuse, etc., during lockdown, etc. And now they're out and about. They're still suffering mentally from various abuse and bullying. How are we going to reach them, and what support have we got to put in place? So it's all about COVID, I'm afraid, but it can come out of order.
Can we bring that up in the item number 7, which is the health and wellbeing strategy, which is where it's reported.
Okay.
If we can just continue with item 5 at the moment. Are there any other questions about the COVID update, please? Carol?
Thank you very much indeed, Madam Chairman. It's just a comment as opposed to a question. So I think colleagues will be very mindful that there was much media around health and social care workers effectively being exempt when they were pinged. It's just to give the assurance and also to give formal thanks to Simon and his colleagues for how they've worked with us in terms of making sense of what was initially at least sparse government guidance, because what we could not do was to ensure that in any way, when anybody had been pinged within the social care, and I'm sure Maggie would be exactly the same thing, and Alison from the health setting, that actually there weren't very, very good procedures that we went through. So Simon and his colleagues have worked really closely with us within certainly adult social care, and has enabled us to really ensure that care providers across the island have the guidance and support that they require in what is a really difficult issue for them, because the very last thing that we would wish to do was to have any retrospective step from the excellent adherence to infection and prevention control measures that we have put in place.
Thank you. Did you want to come in? Michelle?
I'll just give a very brief update about the COVID vaccination booster programme, which I'm sure members may be interested in. Come September, there will be a COVID vaccination programme we were given some advice from NHS England and I last week. I read the advice over the last couple of days. Understandably, because there is still much work being undertaken, the advice actually says that the advice will change, which is quite interesting, really. So firstly, we have to prepare ourselves that the advice will change over the next month. The booster programme will deal with the first 4 cohorts which we vaccinated last time. So the over 70s, the cohorts that were in the care homes. So the first 4 cohorts that we've vaccinated previously. We will try to vaccinate them with the flu as well, although that guidance isn't firm, and we are still waiting guidance whether we can actually vaccinate with the flu at the same time. Whether we can actually vaccinate with the same vaccine that previously people had. So most people actually had the same vaccine. So whether you had 2 lots of Pfizer or 2 lots of AstraZeneca, and the booster will be the same, but we are still actually waiting for guidance. We've gone out to our primary care colleagues, and most primary care colleagues on the island are happy to be part of that programme, but we're also engaging with our pharmacy colleagues as well. And so the guidance came out last week, and we are waiting for further guidance over the summer. Our CCG colleagues are supporting as well, but I thought members may be interested in hearing about that. Thanks, Flora.
That's very useful, and I do appreciate, and I think the whole island appreciates that every 2 minutes the government changes its mind, and then we have to do a quick 24-hour turnaround with the information that we get out. So fully appreciate that. Are there any more questions about the COVID-19 update before I move on?
Yeah, can I just... Oh, sorry.
Right, sorry, Councillor Lilly.
It's a point, Chair. I think I would just like to raise that, you know, the voluntary sector and supporting the vaccinations has been solid right through, the drivers and I think that, and all the hubs and places, you know, like my colleague behind me, you know, Pan, they have been consistent in giving the support, you know, right through. And I just think that we do need to put a big thank you out to them on that.
Yeah. Michael, I couldn't agree with you further. I mean, through rain and sun, and that they've been absolutely steadfast. We could not do that. We could not have done this programme without their support and their smiling faces in the rain and in the sun. And actually, the sun is probably worse for them because it's been so hot out there. They've been absolutely incredible. So yes, a massive thank you.
On the 11th of September, isn't it, Chair? There is is Isle of Wight Day, and that is the kind of island day to thank everyone. So it's right to highlight that. Thank you.
Simon, did you want to come in and
just to emphasise your point, Chairman, around the guidance. Sometimes it comes very late, so actually we get a government announcement and it's challenging. So partners are brilliant at kind of just working through that. So it's really important to note that sometimes we don't know what we don't know yet.
Thank you very much. We move on to item number 6 on the agenda, which is the COVID recovery community economy. And well, that's a big title, Chris. Did you put that in? Really? Anyway, I'm going to do recovery versus business as usual. I think that's a far better title.
Thank you.
Over to you. Thank you.
Thank you, Leader and Chair. Many thanks to the board. My name is Chris Ashman. For those who are on the call, I'm Director of Regeneration and lead in the corporate management team for the Island Recovery Plan. Back in October 20, the Health Wellbeing Board was asked to provide oversight to COVID recovery. And obviously, we've just been reflecting on the fact that to a certain degree, we are still feeling the effects on a day-to-day basis of the pandemic. That being said, the efforts to actually recover from its worst impacts have already begun. And in that sense, the purpose of this presentation is really to seek agreement from the Health and Wellbeing Board on the key matters that should be retained oversight by the Health and Wellbeing Board. And those matters now that have become what we might term, in a slightly throwaway remark, I think, is business as usual. It's not really business as usual because there's a genuine recognition across every aspect of service delivery and in business operations, that we may not ever return to business as usual, but business as usual with greater pressures. So two objectives today, Leader. One is to get comments from the board on those key measures that we need to retain collaborative oversight on. And the second is to actually agree the maintenance of that collective approach to recovery, because it does require a commitment of the agencies and organisations represented on this board to actually dedicate their time, energy and their staff to working collaboratively to move that forward. So very briefly, obviously we have reached the fourth milestone in the government's recovery roadmap, which obviously has lifted most of the main restrictions. We've seen a phased return to the opening of business activity. We've seen the sustained activity in the community around responding to the needs of the pandemic. But I think it's fair, as I said in my opening remarks, that we have experienced what you might call a stop-start approach to recovery. And what I wanted to do was give the board an oversight on the challenges we faced in relation to that. It's worth noting, obviously with the new administration, that there's been a very clear commitment from the administration to seeing COVID recovery being very central to everything that the council does. And obviously then in working with partnership, I'm sure that would be the response of any of the organisations of the public sector. How we do that, how we consider the COVID impact of our key decisions is obviously something we need to consider, not just at this board, but as individual organisations. This was an overview really of our original plan to actually bring forward a three-stage approach to actually identify that we had this continuing uncertainty phase where we were changing from responding to the pandemic into recovery. That phase has gone on quite a bit longer than we originally anticipated. And we really entered the stage 2, we hoped, in October 20. I think it's fair to say that we carried on with that stage 2 now, and some of the actions that I'll be updating you on will reflect the progress we've been making. I just wanted to highlight this slide, which was actually produced back in October 20, and it was a rather optimistic view of what we're hoping to happen. I think I'll just pick out the main central one. It's very small, my apologies, but the furlough scheme, that was originally anticipated to end in September last year. And obviously we're now looking at that ending in September this year. So in the context of general approaches to things recovering, I think we can all reflect on the fact that we've been given a 6-month, if not 12-month delay in terms of what we originally anticipated. So the islands approach is obviously focused on 3 key pillars: how the community will be recovering from the pandemic and the worst impacts of that, health, housing, mental health impacts, the education of our children and young people, the economic impacts, business survival, the impacts on the skills agenda, the potential focus on how we approach the future of our economy, learning from our experience in the pandemic. And in place recovery, what kind of island, as a result of the experience, are we looking to have in the future? What kind of island do we want to create going forward? And a really helpful framework for us all, I think, and Simon, I'm sure, will concur on this, is it gives us an overview of the health and wellbeing framework that identifies the aspirations that we all are working towards in the health and wellbeing strategy. And I think if you look right across that spectrum, you will see that the pandemic has had an effect or an influence on every aspect of that framework, looking at our food supply and resilience, considering how many physical activity opportunities that exist. We've all been struggling with work-life balance in a different kind of blended work environment. So that across the whole framework, there's clearly been an impact and lessons have been learned on how then we seek to recover. So if I move on briefly and very quickly, Leader, into the key points I made earlier, we've reflected in terms of the actions under each of these 3 pillars. We've reflected on the things now that we feel would become business as usual, but we've also reflected on the things that do need that collaborative oversight and focus and reporting to the Health and Wellbeing Board. We generally feel that obviously test and trace was, if you'd asked us what that was 2 years ago, we wouldn't give you a clue, but it's now part of the day job for Simon and his team. So in that context, we can, looking forward, it becomes a new business as usual facility, keeping the community safe, promoting that sense of responsibility for your own actions and behaviours in relation to the outbreaks and future strains of the pandemic. This will become part of our day-to-day lives. But clearly, the impact on housing needs has been significant. There is a need for a collaborative overview of that. We recognise obviously the fact that health and social care services really are in a position of not catch up, but restoration of the services that were engaged. But that is their day job. That is business as usual. Although it's extra pressure to actually do that, it is a business as usual function. But what came out of previous discussions at this board, and Councillor Brodie touched on it earlier in his intervention, is that there's clearly a disproportionate impact on some of our communities to the pandemic. That there's national empirical research that evidences that. We see that on a day-to-day basis in the service delivery that we engineer. So in order to respond to that, we need to consider our approaches overall as a collective public service to tackling anti-poverty and having a spatial focus around that agenda. So bringing forward actions under the recovery agenda to tackle that is clearly a priority. Councillor Lilly touched on the hub contribution earlier. Why would that type of relationship of a hub taking community development responsibility for their area, why not that be something you would want to sustain in the future going forward, that actually then has a much more positive interaction about the future of recovery in that particular community. Our colleagues in education can continue to obviously think around how that year of lost learning can be best rectified and to ensure that our young people restore their prospects for their future. The whole approach and the emphasis and enhancement to the support mechanisms we produce for mental well-being during the pandemic. Lots of really great innovative approaches available to people to tackle that problem. And obviously, coming out of the pandemic, mental health and well-being will continue to be a high risk. And in terms of community recovering, we need to commemorate what has happened. We need to actually celebrate the efforts and contribution of those in the voluntary sector, of those in the public sector, of businesses that have rallied around to deliver that. And I think commitment to that as part of a recovery plan is clearly something we need to sustain. So I just wanted to highlight and remind us, this is from our regeneration strategy, some of those key deprivation areas that we have, those very, very localised, local output support areas that we need to focus on when we're considering our regeneration and our recovery activity. Norman's here as the regular representative from the Economic Executive, and this is really just a very quick overview of some of the activities under the recovery plan that have moved forward under that particular pillar of economic recovery. And the reason I've highlighted the red for, again, retention of oversight by the collective at the Health and Wellbeing Board, as opposed to business as usual, is that the government's Kickstart programme really needs to be an island effort. We're seeing very successful outputs in terms of some small businesses participating. The council in particular is now committed to another 45 placements for young people to participate in the Kickstart programme. This will be the bedrock of the government's approach to tackling skills and employment going forward, and really promoting that and encouraging that across the public sector is something this board, I'm sure, would want to continue. Some of the other activities, trying to put more of a green recovery focus on our economic agenda. The council has been successful in accessing grants to improve the energy efficiency of a lot of our property. Significant, over £2 million of spend on that in the next 12 months. We've also been promoting the take-up in socially excluded areas of a Green Homes Grant, again for energy renewable measures. What's that flagging? It's flagging a lack of businesses that exist with the skill sets and the accreditation to do that energy efficiency agenda. So clearly, it's an action that under the Economic Executive and the regeneration strategy we want to pick up. And crucially, the opportunity afforded by our biosphere coming on to place recovery in a moment will be a significant opportunity for us. Just some key projects there on the right-hand side in terms of the efforts that we put into promoting. Councillor Brodie referenced the Levelling Up Fund application. I was part of a collaborative approach looking at different priority areas across the Solent and putting together a narrative to the government, which is that the South isn't universally prosperous. that there is a challenge in some of our areas, and that Solent narrative contains very, very targeted pockets of deprivation. So we hope that by working together on that, we will hope to see those individual levelling up bids improving their chances of success in what is a competitive environment. The Wight gift card continues to be promoted on the island. It's a gift card that people can show in recognition of contribution and general, obviously, family events, and obviously seeing then that is exclusively spent on island businesses. And what we see in the bottom right-hand corner there is an expression of the biosphere and tackling the housing problem through the implementation of the Branston Farm development, which is now underway and will be completing this first phase next year. So at a regional level, there's a discussion going on about having a green print approach to what we're doing on recovery. And these are very helpful tests about anything that we bring forward in terms of its impact on the environment, but also maximising quality of the design, recognising green skills and employment as a key aspect to what we do. So it's, you know, these are additional factors to factor into our regeneration agenda. Finally, then, on place recovery, we have the island plan published tomorrow. That has clearly had a rewrite based upon the experience of the last 12 to 18 months. You will see the significant impacts in relation to the importance of green and open space, the importance of key infrastructure within the island, and obviously the board's input to that consultation and contribution in response to that consultation will be extremely valuable. In terms of those two key items I talked about for Health and Wellbeing Board overview, the red items, we feel that there's a need to actually grab an opportunity for the island in terms of marketing the place, the way in which obviously people have responded to the island and the quality of its environment in terms of identifying it as a potential place to do business and a potential place to live, provides us with an opportunity to actually communicate both to islanders and to the wider world what our offer is, and actually address some of those deficits and improve our prospects in terms of attracting mobile investment going forward. But that requires everyone's support to actually adopt those principles about what are the key aspects that we feel are important to the island and what its key characteristics in marketing might be. The other one is around housing supply, and that's becoming extremely urgent in the context of the feedback we get from colleagues in adult social care and housing needs, and the opportunity then to have innovation and development of responses to tackle that ever acute nature of the housing market. One of the positive aspects of the pandemic, in some senses, has been there's a lot of interest in purchasing property on the Isle of Wight, but that has had a knock-on effect then in terms of the availability of affordable rented accommodation in particular for those in most need, but also colleagues in the public sector who may be mobile workers between the island. So we feel that needs continued oversight by the Health and Wellbeing Board. So that offer, in terms of our digital improvement, in terms of our biosphere status, in terms of offering a very sustainable living environment, a place that really prioritises well-being and wellness as a key aspect of what we do, and as an innovation hub around a whole range of sectors will be important. So in summary, Chair, in closing and taking questions, I just consolidated all of those red items that really will be something that we report back to the Health Wellbeing Board so that we can get that collaborative intervention. So two things, Chair: agreement that that's the right list and any other additions to it, and secondly, that the board supports the continuing establishment and operation of a multi-agency recovery cell. Thank you.
Thank you very much. I like the green at the bottom. That's so much nicer than the blue. Councillor Lilly.
Thank you. I just wanted to add a few points. Recently, the Voluntary Sector Forum, which brings all the voluntary sector together, clearly asked me to bring a message to this board about health inequalities. COVID particularly has made a huge impact on health inequality. There is a bigger bracket. So people who perhaps had a range of other health issues, right, are more unequal than they were before COVID. Prostate cancer is quite an example within that, and I think that there's a clear. I think we do need to have a focus, and I wish to highlight Professor Chris Whitty's recent report about health inequalities and COVID, and that should be in. So the message from the voluntary sector is we do need to have health inequality as a clear theme overall in all what we do, and I'll come back to that at the in the strategy. I think it's great that the place plan and the placed approach is being highlighted. I would highlight, because of the place plan approach in places like West Wight, Newport and Ryde, had the effect to give really good support in those communities during COVID, and also I think is really driving the recovery, particularly in the economy. And what you haven't got up there is town and parish councils. Town and parish councils have been at the forefront of the support during COVID. They've been linked into all the community hubs, and so in a lot of cases given money. And right, you know, we give about 160,000 to the voluntary sector, and if it wasn't actually that money that was, you know, into it during that time, a lot of things you know, would have gone. I think it's and just lastly about poverty and housing and homelessness, because there's a huge amount of islanders that are having to fight private landlords because they're being evicted. They were actually given. A lot of those are in very poor accommodation. In Ryde, a lot of people in poor basement flats that are being threatened with eviction. They've had they had the time, what was it? There was an amnesty for a period of time. Having to face the fact they've got a damp building, and having to face that they're going and are on trying to go on Home Finder to find that, and that is going to be a big issue in the autumn, and that is linked to the huge rise in Ryde alone. Houses have gone up by 30%, and people are actually coming from the mainland, right? Of that, this is not being bought by local people. This is coming, and that has affected. So affordability on housing now is, well, we've actually said in a report that it was 60%, not 80%. I'd say now it's about 50 to 40% with that 30% rise. You have got a crisis, and we really need to have this as part of the Health and Wellbeing Board.
It is highlighted up there. Most of those things are highlighted apart from the iWork. Councillor Stevens, do you want to come in on the housing, because obviously that's mine and yours little baby?
Well, it's not my little baby, it's the Cabinet's focus, and indeed the Chief Exec's focus. We're going to tackle that head on, and it's going to be one of this administration's main priorities. It's got to be, because if you haven't got a roof over your head, if you haven't got and you're concerned about that, then you've got no health and well-being status whatsoever. So it's got to be one of the very top priorities of this administration, and it will be. And I'm just going to say that because obviously this is such a new impetus we're going to put into it, that I've got to get the take of all of our group and all of our cabinet members, but I can assure you that housing is one of the top priorities. Chief Exec backs us 100%, if not 200%, as does the leader. So take it on board that
I've said it, and if I'm wrong, come and see me. That's all I'm going to say, because we are committed to tackling the housing problem every bit as much as our homelessness problem, which was, how can I say, positively affected last week with the opening of Howard House. We need more of the same projects, and we're hell bent on delivering. So thank you. But I thought I'd mention that because the leader and myself have been engrossed in conversation now for, well, since we came in as the administration, but more heavily over the last fortnight. Thank you.
Yeah.
I can't tell you, that's music to my ears, because as a GP in Ryde, and I've been a GP in Ryde for 15 years now, and my practice is in the most deprived area, and when you put that little black spot up in the north, and housing is the most important for health and well-being, because it's your castle, isn't it? And if you go home and if you're not safe and secure in your own home, then that has the most impact on your health and well-being. So can I sort of poke you a little bit on that and ask you what's your sort of timeline and how you're going to manage that, and the how, because it's so important, and I'm so pleased to hear you say that. I'm sort of almost choked up. It's such great news.
Well, what I'm going to say to you is that this is so new that my cabinet colleagues don't realise that it's coming forward. You're the first to hear it before the cabinet, but they're backing us anyway. But
fantastic.
What I intend to do with the leader and the chief exec is to set up a subgroup. Mm-hmm. Because if you look at the Isle of Wight Council at the moment, we've got part of housing in regeneration, we've got part in planning, we've got part in adult social care. I'm going to pull it together. So you look at me, and I said, and Norman knows as well, hit me with it, and I'll take it on board. But I'll tell you, we're going to tackle this head on. We're going to pull all strands together, and I'm setting up a subgroup, and we're going to move forward with it. Now, how that's the base. But how are we going to do it? We're going to look at ways that we can bring in funding, whether it's grant funding or whether we actually go to the extremes of borrowing. But I'm not borrowing for warehousing in Maidstone or Trafford. I'm borrowing for the people of the Isle of Wight, and to actually, if you like, look at the investor save. Look at your doctor's surgery when you've got broken families, distraught people. We can save money by just tackling the cause and not the effect. Okay.
So the timeline on that?
The timeline for starting is now. We're on the move already, and this afternoon we will be having a meeting and progressing it. But we'll watch this space. Is all I can say at this moment in time, because I haven't got a bean in my pocket, but I've got a willingness to succeed. So we could bring that back to the next meeting, maybe. You can bring it back to me daily. I don't mind, and but maybe this meeting. Absolutely.
Right, I'm going to move on then. I know Carol wants to ask a question or to speak. Carol?
Thank you very much, Chairman. So just in terms of the housing issue at the minute, and regards to potential solutions, there is a fundamental, I think Councillor Lilly really spoke to this. There is a fundamental difference in the nature of the households now approaching the council who are at risk of homelessness. In the quarter ending the 30th of June, just gone, we received 456 approaches from homeless and potentially homeless households. But the key difference is that 25% of those households are in full-time employment. So we've got a notion here, it really links into, I think, the health and wellbeing strategy a bit later on with regards to not only the availability of housing, but also the absolute costs of housing and how that then relates to increasingly our wages on the island. The solutions, they're at least fourfold. The first is we have to look at the supply. And that necessarily, in terms of number one, means really difficult and necessarily longer term discussions about house build, and that's why the island plan is so important. The second is how we work with our RSLs on the island, the registered social landlords. They between them have 7,000 properties. But in the last year, ending the 31st of March 2021, there were only 250 relets across those 7,000 properties. So what we've got to look at is how can we work with our registered social landlords in terms of promoting flow, so that, for instance, if a property is under occupied, what can we be doing about that? The third is obviously around around private landlords. The council has for some time and has extended it in the last couple of years or so, its landlord leasing scheme and the support that we give to people around helping them with their deposits, etc. But what we are seeing, as again Councillor Lilly I think has indicated very well, and reflected then by Councillor Stevens, is we are seeing a massive increase in rents because of what's happening to the private sector. And then of course we have the council's empty homes strategy. So this is a wicked issue. It is my department. Councillor Stevens has said that responsibility for housing is spread across different parts of the council. That's not unusual, but it does make things sometimes more complex, I guess. But it is the adult social care and housing needs who really are at the front line in terms of what are some heartbreaking situations that people find themselves in. And we do have the perfect storm in terms of rising property prices on the island. And by the way, they went up by 11.46% on average last year, and probably even more so since the 1st of April. So we've got rising property prices, relatively low wages, and we've got private landlords who no longer benefit from the tax breaks around their interest mortgages, and the moratorium, as Councillor Lilly pointed out, which helpfully was put into place during the pandemic, but that moratorium is now no longer gone, and what there is in law now are so-called blameless evictions. So you can be a really good tenant but still be faced with evictions, and landlords are giving eviction notices for 3 months with 3 months notice, which is what's required of them, to tenants who are very, very good tenants. But they are doing that for two reasons. They've either decided to sell, or they know they can let for a much higher rent. Sorry, I know that was a bit lengthy, but I wanted people to have the contemporary picture.
Housing is an important issue, Carol, and it's one that always raises a lot of debate. I'm going to bring in Sarah Jackson and then Simon.
Yeah, thank you, Chairman. I just wanted to add, goes without saying, of course, in terms of policing, what we see in terms of our high-risk offenders is lack of accommodation really impacts on their ability to recover, whether you're talking as a result of crime, mental health, substance misuse. So I'm absolutely with everyone's comments about how important housing is, particularly to those vulnerable individuals. And of course, when we're talking about victims of domestic abuse, which we spoke about a lot last night at the public CSP meeting, housing is such a crucial part of that too, and support for those victims. So I just wanted to add that kind of policing context and echo actually the point that Chris made around housing for our staff as well, and the challenges that we're facing currently in respect of that. Thank you.
Okay, Simon.
Thank you, Chair. There's a danger of moving to the next item because it's really important. I think from my perspective on this housing option, as a health and wellbeing board, one of the things we discussed is being really clear on what the health impacts of housing are. So actually, we're not a housing body, and that's absolutely right. But we need to be a critical friend and supporter to say these are the health needs that are impacted by housing, and how we do that as a board. But I'm in danger of going to the next item where we want to make sure we're clear.
Okay, is there anything else on any Chris? Chris is sat there. Are there any questions for Chris directly If not, we'll move on to the next item where actually you can see that there's a lot of this information comes in on this. Is everyone okay? Yep. As long as it's a question, Councillor Lilly, yes?
The question is, can this board, or through Chris Ashman, really engage with the social landlords of this island? You know, Sovereign, Vectus, Southern, because not only are they landlords of some of the most vulnerable and poorest, that have really been affected by COVID, especially ones that are living in flats and inside lack of green space. But they also, we need to support them to build homes and develop. So I think they should be properly represented on this wellbeing board in discussion. So that's my question.
Yeah, can I just say yes? Whilst as you would expect from a regeneration director, our conversation historically with our housing partners has been about their development plans. More recently, as a result of an action identified in the recovery cell, we now have a dedicated subgroup of the 3 social housing providers looking at the broader recovery issues, and I can report separately to the board on the discussions and the focus of that conversation. Thank you.
Norman, did you want to come in? Okay, so we're going to move on then to item number 7. Thank you for that, Chris, very much. As I did say, COVID recovery is at the heart of everything, because without that recovery, everything else falls down. So that is at the heart of what we should be doing. Okay, so we move on to item number 7, which is Simon again, which is the Health and Wellbeing Strategy document. Thank you.
Thank you, Chair. So, colleagues, just to update you, we need to have a health and wellbeing strategy, as the Chief Executive said earlier. It's complex. There's lots of strategies playing into this. We've done a lot of work with colleagues. We've started this piece of work early, which is absolutely right, so that we can then really prepare for our strategy in April next year. What we want is a vision about people living healthy, independent lives, thriving, connected communities with timely access to high quality integrated public services. So that's something we've been aiming for in the last strategy. It's quite a generic thing. So what does that mean underneath? On slide 2, we've identified a number of areas we wanted to focus on, and Chris and I have conversed, but we've not formally connected our presentations, but there's so much synergy there. I think what you're seeing is the fact that we want to focus on the areas of poverty, inequalities, deprivation, double poverty there, children, young people, working with the Children's Trust Board, the long-term health impacts of COVID, so community recovery, long COVID, and mental health and well-being, getting people physically active. We've got the presentation from Energise Me around that, and then housing and health. And I'm really clear it's housing and health, not housing. Housing is an important issue, but actually what's the connection for this board? So these slides are really a start of a conversation. Actually, we had some suggestions previously, and I've started to put some information behind that to say actually what goes further. I pick up Councillor Lilly's point. We've perhaps focused on poverty. We need to just broaden that out to inequalities in general, and I think we could do some work there to make sure that feeds through all the plan. So that's the first few slides, and I'm glad that Chris and my data matches up on those most deprived wards.
Simon, can I just ask you a quick question on the slide about the poverty, the fuel poverty, which is, I think it's the next slide.
Slide 4, yes.
I'm curious about the wards with the highest level of fuel poverty of Ventnor East, Chell, Knighton, Whitwell, Ventnor, Godsall and Wroxall. Is this because there's no access to gas there, gas mains, and it's run on oil? Is oil expensive? Is that just the people
say I'd have to dig behind it, but I think there's about access to the.
Okay, thank you. That's worth noting.
As you said, there's a number of bits of data we pulled together just to try and illustrate some of the issues, and I think Chair, conversations like that are really helpful to take that conversation forward. So we've also got, as Chris will know much better than me, the unemployment issue, which will fall into kind of Chris's domain, but really we know unemployment will impact on health. So what do we want to do as a Health and Wellbeing Board? And I think the fact that we're bringing recovery into this board really shows that we're tackling those causes of ill health. Bearing in mind, I keep saying we're a Health and Wellbeing Board, not a kind of all-encompassing board. So we've also thought about children and young people, and the slides there. So I'm on slide 8, really talks about the impact on mental health and well-being. I think we really need to think about that as the board, what we want to do together to tackle both that end that people talk about CAMS a lot, actually, but it's the whole spectrum, that kind of more the lower end of needs, so that anxiety, maybe the bullying and things, we want to tackle that. So we're saying those are really key things for us to tackle as a board. I'm presenting these things, but really want to welcome challenge and conversation afterwards, so I'll do it fairly quickly. A number of things about mental health. We've also then put in some of the actions we've got in each of these areas. So we've got work with schools, we've got the youth trust, we've got CAMS developments. Long-term impact of COVID, both long COVID and also those things that people have missed. So we know that cancer screenings were delayed, so how do we make sure we pick those up? And how do we really think about those people with pre-existing health conditions? As a health board, what do we want to do there more? And we've got some really exciting programs around coronary heart disease and diabetes and things like that. So we'll take some work there. Community recovery, linking to particularly what Sarah Jackson was saying, really around the kind of community safety aspect. We need to think about how do people feel safe to go out again and link in there. And again, it's making sure that we as a health and wellbeing board don't do what another board's doing, but are related to that. So how we connect together. So it's great that Sarah's part of this board. We've talked a lot about, as I said, long COVID, and we're getting more information. There's services for long COVID, but actually what's the bigger impact of kind of the longer term impact of that acute infection? And then mental health in adults, we talk about that a lot. Actually, we need to really take our focus there, particularly focus on inequality. So how do we really think about that as a programme? We've got some really good programmes with the Isle of Wight Trust and the CCG, where we're tackling mental health and wellbeing, both thinking about the service end, which is great to hear the CQC report, but also that population approach to improving health and wellbeing. And also back to, I think it was Sarah's point, our staff have both been through a really kind of challenging time, but if we have good staff health and wellbeing, that will improve the health of the island, not only because they work with us, but they live here as well. I'll focus a little bit on getting people more active. We've got the Energise Me strategy, which is for the whole of the Isle of Wight and then the wider area. And if we could talk about that in that item, but I think being physically active helps mental health, helps mental well-being, and helps some of those risk factors that we're concerned about, including coronary heart disease, diabetes, and other things. And then finally, we agreed we want to really look at housing, and I've tried to be really focused here to think about housing and health, so that actually we as a board can be as I said, a critical friend to the housing development, so that we know what we need from a health impact, as Michelle said, as a GP, she sees that, and we see the issues of damp housing with asthma. So what can we do there? Chair, I'll stop there. I was going to canter through the presentation, but really it was to present some information to develop further, so that by April we can have a health and wellbeing strategy that focuses on the right issue for the island, for this board.
Okay, are there any questions for Simon on this? I mean, I don't really want to go. What I would prefer is if members could actually, I've raised quite a number of things on each slide. I think it would be useful just for us to send those through, so that Simon can actually answer those and bring that strategy back to the next thing with some of those answers. So if you are all happy with that, is there anything burning that you want to ask? I can see you glaring at me, Councillor Lilly.
I'm happy to do that. I just wanted to point out a couple of things. One was, we have new wards on the island, and I think we need to adjust to those wards. So, for instance, you mentioned Ryde North East as a deprived area. Actually, that doesn't exist now. It's actually Ryde Apley, Oldfield, Ryde South East, and Monkton Mead that all have serious deprivation issues. So I just think it would make clearer in do that you can actually change.
I just answer that because the data we have is based on the old wards, because it won't be. Well, as soon as it's updated for the new wards, we'll put it in. We'll have
I'm just saying that people will get confused. They say Ryde Northwest East doesn't exist. The other particular point, which I think is really essential in the chat, that comes out of COVID. We do need to get the town and parish councils, the rest, the public sector and the voluntary sector as they have been doing through COVID, out of necessity. So, for instance, housing associations in Ryde, for the first time, have been talking to Ryde Town Council, which is absolutely brilliant. We need to make sure that we have got that partnership approach that is really working together. We cannot lose that, because that has come together through COVID, and we really do need to keep that and work on it. And the other thing is on public, health grants and everything. We need interventions. We need actually people doing things. I think there should be a campaign of doing, not data. I mean, yes, we need data, but we need actual interventions, of getting things down in the grassroots and actually seeing real outcomes at that level.
So if you can put those, articulate those into the slides with the page reference and send them through to Simon so that he can continue to work on the report. Is that okay? Thank you. Debbie, did you want to come in? Councillor Andre?
Just briefly, thank you. In terms, you did mention children and young people. I think it's very important to note that I think we are just at the beginning of seeing the effects of COVID on our children. I certainly know that going into the school holidays, we are now seeing, and I'm sure the data will support this, that our children and young people are now the ones that are being affected, not to such a severe level, but in terms of going into the school holidays, we had a whole flurry of children and young people, and then associated with our teaching professionals that had to self-isolate. But just to say, this is something that we are very mindful of. One concern I would like to highlight is obviously going into the summer holidays, our teaching professionals have been fantastic at actually identifying those pastoral issues, as it were, with the mental health and well-being of our children and young people. It is a concern that throughout the school holidays, and especially has been highlighted, all those other things that actually feed into the health and well-being of our young people, such as housing, poverty, family cohesion, that's obviously a concern. We did actually launch a campaign at the beginning of this month with our domestic abuse project officer, working closely with partners to actually target a particular age range of 11 to 18 to actually highlight the help that is available. So we are very much aware, and of course that will be supported by the RSE curriculum. But just to let colleagues know that we are very mindful that it was an incredibly stressful time going into the school holidays, and we haven't taken our foot off the gas, as it were. And we are very mindful that there is still work that needs to be done, and that those effects, it is long COVID, but in terms of our children, we are well aware that those interventions still need to be put into place. Thank you.
Okay, can I bring the Chief Exec in? He's been waiting a very long time. Thank you, Debbie. We know Debbie's very passionate about the children's service, which is why she got the job. Thank you.
Thank you, Chairman. I think in terms of thinking about this, and Simon's produced a really helpful data pack with lots of information in it, what I think we have to do collectively, the board, though, is try and focus on the one or two other three things that we're going to focus on collectively, because we can't do everything for everybody, much as we would like to. And Simon, I just wonder whether or not it's too early for you to have drawn a conclusion about what those areas might be. I mean, we know we've heard about housing in terms of numbers, and you've certainly highlighted healthy housing, and you certainly highlighted poverty, and you've highlighted mental health. But what would you be thinking at the moment, subject to what people might say, might be our collective three priorities, so that we can really put our shoulder behind and make a difference?
There is a bit of a danger with the health wellbeing strategy, trying to do everything you say, and you kind of say, well, best start in life, best, and so I think you're right. And I take Councillor Andre's point. I think the mental health and wellbeing of our children, young people, and I take your point in the broadest sense. So actually not about treatment, and I think that would be something we really want to focus on. I think it would be, as we're developing a really good approach to housing, how we make sure that housing and health, and as I keep saying, the health bit for us is really important. And then I think we also might want to think about the inequalities agenda through all ours. And I think if we can then build that in, those might be the things that we focus on, because then that would, to be carefully saying, we'll be challenging the Isle of Wight Trust. What are you doing about inequalities? Challenging, GPs. So I think those three things are the ones I would talk about, but actually perhaps keeping a weather watch on some other issues as well that then may come through. But if we could do that, that'd be really helpful.
That's great, gives us a focus. Did you want to come back on anything, Simon?
No, what I'll say, if I take those comments, I'll carry on developing this, focusing, as we've said, on those areas, but we'll bring it back each meeting so that as you see a strategy starting to develop, we can keep commenting and amending, but talk to me outside if that's helpful.
My vice chair's not doing a very good job here. Sarah, would you like to come in? She said she was going to keep an eye on people for me. Sarah, would you like to speak?
Just a very quick point, and it links to what you said, Simon. For me, it was about identifying what are our biggest risks to the community, and therefore that's what we should be focused on. So absolutely, that will help us focus down what we want to try and achieve, rather than trying to be all things to all people. Thank you.
Okay, moving on then, thank you, Simon, for that report. As I say, I think there's a lot to work on. I'm quite pleased that we've got a focus of maybe 3 key things. So we move on to item number 8 now, which is the Joint Strategic Needs Assessment. That's you again, Simon.
Apologies, Leader. I'll be quick. So for those who haven't been around the table for so long, the Health and Wellbeing Board has a responsibility to produce a Joint Strategic Needs Assessment. Almost a bit backwards from the previous presentation. So what are the health needs of our island population? And we are fully aware that COVID has changed the health needs because we've talked about these issues. Both we've seen, sadly, mortality we hadn't seen before. We've seen, as Councillor Honours, the mental health and wellbeing issues. So what we are doing, and this paper sets out how we as a public health function are going to undertake that. So we're going to do a health impact assessment, and that really focuses on the health impact of COVID so that we can share that with the board. Then we'll do some core documents around demographics and vital statistics so that actually we can see the health needs of the island. And then we're going to pick up some main chapters during the autumn: healthy people, healthy living and healthy places. But also making sure we focus on what we've called inclusion health groups. So those more vulnerable groups, and it's a bit of a kind of catch-all term, there's all sorts of terms from physical ill health, substance use dependencies, poverty. So we're going to wrap all those things in together so that actually we'll have a really strong joint needs assessment. Hopefully the time will work with the strategy we're developing so that actually we can then pull that together by April and go, yes, they're developing alongside, but we'll tweak it according to what the joint strategic needs assessment tells us as we drive forward. And if we find that we're seeing something different, I will bring that to the board and we can work out how we place that. But we might say, for example, there's something that we want to work with the police on more specifically rather than the Health and Wellbeing Board, so we'll do that. So it's a statutory duty of the board. I hope people are accepting how we're developing that.
Are there any questions? Councillor Lilly, question?
My question is within this, can you can we look at what is working well? Because actually we've talked about things that are not going well, but there is interventions on this island that really do help within this agenda, and I just think we do need to highlight those. All right.
I don't think that's the role of the JSNA. That's a different project. Sorry, Simon. Sorry to.
Yeah, absolutely right. So we're identifying the needs, and alongside that, there will be some really good things about the health. So actually, it does come, but then we need to take that forward and go, what do we need to do? What's working well? And I put some of that in the other presentation.
Chairman, I think if it helps, we can pick up the what's working well through some of the work that Chris is leading through the COVID recovery cell that we talked about earlier. So I think you're absolutely right to capture that. Yeah, thank you.
Okay, so this report is just for noting. So if everyone's okay with that, thank you. Okay, we move on to item number 9, which is the Better Care Fund.
Thank you, Madam Chairman. Laura and I perfectly rehearsed, so we're going to do a double act. I'm going to introduce and Laura will then take you through. This is another statutory duty of the Health and Wellbeing Board, in that the Better Care Fund has to come to the Health and Wellbeing Board so that you officially sign off that the 4 national conditions are met. Those 4 national conditions are on page 41 of the report in front of you. But this year's been slightly different before we go into the content of our Better Care Fund for the Isle of Wight. This year's been slightly different in that in sort of late summer of 2020, government, because of COVID, said that it was not going to be issuing the usual planning guidance, and that therefore it wasn't going to expect the same level of granularity of return from each area about the use of its Better Care Fund. But it did still require health and wellbeing boards to ensure that the fund was legal, in terms of it had met the 4 conditions, and those are really around the contributions from each partner. So there's the mandated minimum contribution from the CCG. It's the mandated contributions from the council in terms of the improved Better Care Fund and the Disabilities Facilities grant. That it also includes all of the CCG spend commissioned on out of hospital services, and that actually we focused on hitting the key priorities for the Better Care Fund, and those are very prescribed. So before I hand over to Laura to explain how our 53.2 million has been deployed through the Better Care Fund over the last year, it's just, I think, important for me to stress that the government is yet again thinking a lot around the future reform of the Better Care Fund, which has always been the primary vehicle, financial vehicle, through which integration across health and care is delivered. And therefore, what you also have attached to your papers is early sight, and it's still draft, is very early sight of some of the changes to the metrics which government is thinking about introducing for this current year. And it's fair to say that we're all eagerly awaiting that, in that we're now into Q2 of the current year, and we have still to receive from government the guidance for this year. So what you have in front of you is your statutory duty in terms of signing off. It's important to say it's already gone in, because the deadline was the end of May, but because of our elections and then establishing an administration, this has been the very first opportunity that staff have had in order to bring this before the board today. But at this point, I just want to hand over to Laura, please, around some of the contents.
Thanks, Carol, and colleagues, just to provide a bit more information around that, the full submission is included in your papers for you. It's lengthy, it's detailed, and I'm ever so grateful to colleagues in Democratic Services for making that work with the format of these papers, because after hours of trying, I epically failed. So I'm pleased that you do have it before you. We have Alison here, and I'll invite Alison to comment afterwards, but I think in terms of highlights for you, the majority of spend that we see is based on care and support in the community, be that through our reablement services, rehabilitation, community matrons, district nursing, the continence service, crisis response, and latterly through the development of the integrated discharge team to support people coming from hospital back home, wherever home may be for them, but hopefully their own home during the pandemic. The document provides with you, for you, a lot of detail around those schemes, the funding that's available, and I'm pleased to confirm that from the local authority and CCG point of view, we've managed to meet all of the mandatory conditions that were in place around the Better Care Fund. One of the questions we were asked in this submission was, did COVID derail us? And we were in a really fortunate position that actually for us locally, COVID helped us to deliver some of these things. Historically, we've seen challenges in delivering some of the more joined up and partnership pieces, and I'll use trusted assessment for exiting hospital as being a prime example. Lots of people are involved, lots of people have different views as to how that should be done and what good or right looks like. Through the pandemic, we were able to fast track the work that we did there and to put in place a solution that worked for everyone, whereas historically we'd already spent best part of 2 years talking about what that could look like. As a system, the Better Care Fund works for us. The only significant change for you as a health and wellbeing board based on the previous year's return is the inclusion of continuing healthcare and funded nursing care. It's a substantial chunk of money, but that relates to the decision to integrate that service into adult social care that was taken by the former cabinet back in 2018-2019. And I'm pleased to confirm that the Better Care Fund came in on budget and achieving all of the outcomes we set out to achieve. I will cross over to Alison now so that she can confirm from the CCG's point of view that I'm not selling you down the river, but also I'd welcome any questions that members have in terms of the schemes within the Better Care Fund or the spend attached to them after Alison's opportunity.
I think I can confirm that Laura's done an excellent job, as you would imagine. We work very closely on this, so I'm very pleased to accept that report. Thank you, Laura.
Happy to take any questions, Chairman.
Are there any questions? Oh, okay.
You've got woodlands down here. Has the new woodlands sort of, improved, been open? Is it changed? I was told it was meant to be on it from the 1st of April, but has it? Because it is part of the Better Care Fund.
I think this is because it's the previous year, not for the coming year. So the coming year will reflect the changes in the next submission that we do annually.
So have the new woodlands open?
I can't confirm that because perhaps somebody from the trust would like to confirm that.
Hi, yeah. Kirk here from the trust. I think Maggie might have dropped off the call. I can confirm to members and colleagues that the registration has changed and it's now social housing. So the old Woodlands unit no longer exists and it's in its new form.
Is it occupied?
Yes, as far as I know, but I'll double check and confirm in writing.
Superb, Kirk. Thank you.
No problem.
Well done.
Councillor Andre?
Thank you, and thank you for confirming that we've met all our mandatory requirements for the BCF. Can I just ask, in terms of the improved Better Care Fund, what applications have been made in respect of that, and what in terms of where has that been placed, the IBCF? Thank you.
Councillor Andre, I can confirm that the IBCF forms part of this reporting, so it is within the work streams and the schemes that are before you today. We took the decision as a local authority when the IBCF funding came into us to work with colleagues through the Better Care Fund arrangements to ensure that the deployment of that resource best met our system aims. It's been utilised in a number of different ways. It's supported the voluntary sector in terms of the Living Well service. It's supported our independent sector through enhanced training, working with Mountbatten and the CCGs as our partners to take that forward to drive up quality and improve the offer that people receive from the independent sector. It's underpinned some of the adult social care workforce that's been integral in enabling the integrated discharge functions to really come to fruition over the last 18 months. And in addition to that, pockets of it have been deployed in other areas to meet shortfall in funding that we've seen over the last 18 months, 2 years, to enable services to be sustained. Inevitably, what we're seeing is that services are costing us more, not because providers are charging us more, but because there's a greater demand for them and the complexity of the people needing to access those services are increasing. That has a budget impact, as I'm sure you are very well aware, and the IBCF has enabled us to manage some of that inflationary increase and that demand increase that ordinarily we wouldn't have had the opportunity to do so. I'm really grateful for our colleagues in our finance team for working so closely with us to enable that to happen, and can confirm that the local authorities finance team work very closely with CCG finance colleagues to ensure that we're avoiding any duplication of use of funding, but also getting the best value for money we can from all of the funds that are so limited across this part of our sector.
So am I right in thinking that actually the IBCF is perhaps not as tightly ring-fenced as the BCF?
I think that's correct. The Better Care Fund derives largely from mandated contributions, whereas we've had some discretion as to how we've spent the improved Better Care funding as it's been received. Our aim has been to ensure that that has the most impact for local communities, to keep that money on island and to work with our partners to ensure that we've been able to make that happen. I'm conscious that Carol's in the background and I don't know whether she'd want to add anything to that, because she was certainly instrumental in the discussions around how we deployed the IBCF in those early years.
So I can confirm that there were grant conditions attached to the IBCF. And those were around ensuring that we impacted upon delayed transfers of care. And as you can see from the second document, government suspended that during COVID and isn't going to be reintroducing the old DTOC PI. It's got some others instead. So that was number one. Number two was around emergency admissions into hospital. The IBCF needed to benefit that, and it also needed to benefit reablement. So we used it, as Laura's just explained. For us, the IBCF was pivotal around some of the key programmes of work that we've been seeking to and have delivered via Care Close to Home.
Okay, are there any more questions? No? Okay.
Chairman, I think we do need to formally just approve the paperwork in front of us, if that's okay.
I propose.
Oh, thank you, Councillor Lilly. Proposed, seconded by Councillor Andre. All those in favour?
That's great, thank you.
Thank you very much. So we move on now to item number 10 on the agenda, which is the introduction to Hampshire and Isle of Wight physical activity strategy. Oh dear. Okay.
I'm just going to do a very quick introduction. So Energise Me are a local charity that specialises in physical activity, and they have developed, after a lot of consultation, a local strategy which we work with and we'll be implementing on the Isle of Wight. So I'll hand over, I think it's to Julie Ames, the Chief Executive, and Helen Fisher, their health lead, who are on screen.
Thank you, Simon, and I'll be very brief before I hand over to Helen. Just to say that the timing today couldn't be more brilliant. One, because we launched the strategy yesterday, but two, in the context of all of your agenda this morning, it is very relevant, in particular around those health inequalities. So at your last meeting, for those of you that were there, you received a report from us on the impact of COVID on physical activity levels. And that really highlighted the fact that during the pandemic, those inequalities that existed before were compounded through the pandemic period. So this strategy is very much focused on tackling those inequalities. The final point that I just wanted to make is that we've had brilliant engagement from the Isle of Wight through the period of the consultation process. And I just want to thank Simon and all of those colleagues on the island that has helped to facilitate that engagement, because it is a strategy for the Isle of Wight and Hampshire, and covering a geography that size can be quite difficult, but we've made sure that throughout we've had engagement across all of our geographies. So thank you to Simon and the team that have really helped to facilitate that. I'm going to hand over to Helen now, who will walk you through the strategy. Thank you.
Thanks, Julie, and thanks, Simon. So as Julie highlighted, we brought a paper to the board back in March. In that paper, we introduced the board to the work being undertaken by Energise Me, the 4 public health teams, and Hampshire, Southampton, Isle of Wight CCG to develop a new physical activity strategy, which aims to address all the health inequalities that you've just been talking about today. The We Can Be Active strategy was launched yesterday. You will have received a copy with your papers for the meeting, and hopefully you'll also have a copy in front of you of the presentation today if you can't see it on the screen. Today, we're asking the board to adopt the We Can Be Active strategy and support the Isle of Wight We Can Be Active event in September. So We Can Be Active was created by over 800 individuals and organisations across Hampshire and the Isle of Wight. It began with an online conversation and focus groups with young people to find out what would make it easier for local people to be active. The ideas and experiences people shared during the We Can Be Active conversation brought to life some of the issues raised in the World Health Organisation's Global Action Plan on Physical Activity, a plan which is based on extensive analysis of physical activity data and evidence from around the world. These experiences and ideas became the focus of a big planning session back in March, attended by over 200 people from organisations across Hampshire and the Isle of Wight, and as Julie said, really well represented from island organisations. And from there, we developed 5 broad goals that summarise what local people told us need to be active. They said they need positive early experiences for children and young people, and we know there's some really good work that's being done in and out of school already, but we know that it isn't necessarily reaching everyone, and that came out loud and clear in the online conversation. So we need to work with children and young people to create or improve these early experiences. They also told us that we need to make opportunities easier to find and diversify those opportunities by adding movement into other interests, such as arts and culture, and how we move from place to place. Which leads me on to the places and travel routes. And again, this was a real area that people felt strongly about, that we need to transform local spaces to make them feel safe, attractive and accessible. We need to unlock the potential of underused spaces in local communities, such as car parks, patches of waste land in estates that can then be used for people to be active. And also focus on how people move between place to place. And I know there's been a lot of work done on the island in terms of active travel. People know that they need to be active. They've certainly got that message loud and clear, but what they need is support to help get started or keep going when they're finding it hard. So therefore, we need to really use the campaigns to challenge the perception of who can be active. So people with long-term health conditions and ensure that that message is given by health professionals throughout the system. And also getting these physical activity conversations happening regularly with patients, clients, colleagues, family and friends. And finally, in order to make this happen, not one organisation can do it on their own. So there needs bold leaders working together. Anyone can be a leader and advocate for physical activity. And we really want people to be open to working across sectors and learning from when things don't go to plan. Behind each of these goals are personal stories and experiences that highlight things that need to change if we were all to be active in a way that suits us. But strategy is only useful if things change as a result of it, and therefore work is underway to galvanise a collective effort from people and organisations on the island. There will be a planning event on the 23rd of September to discuss what actions we can all take to support inactive people on the island. This will be translated into a shared action plan, which will aim to bring about the changes communities need to make it easier to be active. Energise Me will provide ongoing support, resources, training, investment where needed to support organisations on the island in the delivery of this plan. So today, we're inviting the board to adopt the We Can Be Active strategy and to commit a representative from each of your organisations to join us at the planning event in September and really be a part of what changes need to happen. Thank you. I'm happy to take any questions.
Are there any questions? I've got a couple of comments. The Couch to 5K was very popular during lockdown, and that's something I think that should be promoted more. It definitely seemed to get quite a few people up. And also we've got an issue on the island, particularly on the island actually, and that is around the lack of pavements. So we've got a lot of beautiful open spaces, but you're walking sort of in the road, and I think that is an issue actually for us, particularly sort of around, in a lot of the rural areas. But it's a good report, and I think it's really nice because it's very easy to read. It's very easy to pick up those issues. I'm the worst person for exercising, but I do have 2 doggies. I'm going to bring in Councillor Lilly. Thank you.
Totally agree with you, Chair. The this is very good, and we need to get people active, and I think we really need to get behind this, so I totally support it. I think we need to make sure that at your planning meeting you've actively got the town and parish councils that are involved. Obviously the GPs are extremely important, and also the voluntary sector. And I want to highlight, we on the island have a very range of sports active organisations. I mean, the beach festival, well, they got rained out the weekend, was incredible. There were thousands of island young people, doing beach sports and things. And we need to make sure that we don't duplicate what they're doing and actually make sure that they're part of this. Rowing clubs, sports clubs, we have a range of sports on an island, and they're run by volunteers, and we need to make sure that they're integrated and supported.
Can I bring in Councillor Andre?
Thank you, Chair. I make no apologies for my focus obviously being on children and young people, because as Chair has mentioned, well, I'm lead member and it is my passion. I'm delighted to actually see one of the comments is from one of our very own officers saying that he will support the Isle of Wight Youth Council to consult and engage other young people to deliver on this agenda. But I think this is a great start, and I certainly think it's something that we should get behind and support. But I'm a little unclear at the moment as to how this is actually going to work. I hear a tool, and I readily accept that will come out with the planning meetings in September. As I understand it, there's going to be a toolkit, but please don't underestimate the excellent work that is already going on, for example, with our Peach programme that actively works, and Simon will very much support that actively works with our schools to encourage physical activity as part of children's wellbeing. Just a few statistics, and I'm sure will be no surprise to us that childhood obesity in the UK today, 1 in 5 children are overweight on starting school. Obese children have a higher risk of developing diseases, including asthma and type 2 diabetes mellitus. But interestingly enough, are also reported to have low self-esteem, which feeds into the other agenda items that we've been discussing. There also is a correlation between childhood obesity and inequality, and statistics from the National Child Measurement Programme actually show that increasing childhood obesity is associated with inequality, and that children from the most deprived areas are more than twice as likely to be living with obesity as those from the least deprived areas. So whilst I do very much welcome this initiative, it does need to be a partnership approach to actually bring in and embrace all of the activities. And I won't go into them now, but there are lots of provision that is already going on. So thank you for this.
I'm going to bring in Simon because he was waiting patiently. Sorry, Simon.
Not at all. I absolutely agree with what Councillor Andre said. And I think, yes, back to our theme of inequalities, we've got to make sure the strategy, and we will, does tackle inequalities. And I think just back to the chairman's point about kind of couch to 5K, we've done a couch to 2K for children. And how do we all, and I guess as leaders, how do we do that? Can we think about, for ourselves, can I park at the other end of the car park and walk a bit more? So what can we all do, just gentle steps to increase our steps, I think is what I'd also challenge ourselves to do as a board, because we all spend a lot of time in meetings. But really welcome this, and our team work very well together on Peach and many things.
Thank you, Chairman. Unless I've kind of misunderstood where this is coming from, and obviously with the benefit of the previous meeting, this is inviting us not necessarily to take some of the work that's been produced by Energise Me and deliver it for them. It's about to take the concepts that they put together and to build that into the way that we do our work and the way that we do our daily jobs and everything that we do in terms of our thinking process. They're offering a coordination type role, a PR comms type role, and they're offering to track the progress that we all collectively make in this really important area. So I think we can. I know you've got to come to a decision about accepting the 2 recommendations, which I would wholeheartedly endorse. But I think it's not about waiting for the strategy; it's about getting on and doing things in the context of the conversation that we had a bit earlier.
Okay, if you can convert me, you've done it. You've done a good job. So maybe I'm the first person to try. Thank you very much. I think it's so good because you've done it in a really simple and easy way. I didn't know about that couch to 2K for the kids, so that's an interesting one. And I think we're all missing a trick, that we need some kind of directory where you can actually have all of the community groups that are across the island. There are many of them, but I don't suppose, look, the Cow Sea Cadets, for example, they're out white water rafting, they're doing, I mean, it's phenomenal what they do, but so few people seem to know about it, and yet it's open to everyone. It's about getting that message out there. There's a lot of stuff out there. How we coordinate it all together is another thing. Carl.
Yes, thank you, Chair. My apologies for being late. I did try to get in online, but it wouldn't let me in. And then when I did get in, I couldn't speak. So it's one of those things. It's one of those things that happens. Yes, the strategy. I think it's important that we do develop a strategy, and I agree. Councillor Wilcox has beaten me to it in terms of what I was going to say. It's important to place all of the voluntary organisations and all of the other providers at the centre of this. It's not just the case of having 2 or 3 representatives from this and nominated groups. We need to get out there and engage in the development of a strategy, and of course Health Watch to be part of that consultation as well. So the bit that I've kind of missed is with the consultation. Do we know how many people from the Isle of Wight participated in that consultation?
So, Chairman, we had over 15% of the organisations that attended the planning event and inputted were from the island. So in terms of the whole of Hampshire and the Isle of Wight, that was a significant representative sample from the island, given the population of the island compared to Portsmouth and Southampton, some of our other larger authorities. And then in terms of the online conversation, we had 255 people take part in total, and 30 of those were from the island.
Okay.
So if I can just come back, I mean, it's important because, 30 people representing from the island, we need, if it had said 300 to it, I'd have been, really impressed with that. But 30 is just the tip of the iceberg, and that's why it's so important to make sure that everybody else engaged with this process.
I think we could all be accountable for not actually taking part in some of these things. I don't think that I did. I would have been the bad one. Anyway, Sarah, would you like to come in, please?
Yeah, just a brief point, picking up on Councillor Andre's point about children and young people. We have got a lot of activities on the island. I know we have. The challenge, though, is to how to access the non-joiners, and that then impacts on equality and poverty. So that will be our challenge, is how we actually bring those people in. So when you talk about the work of the youth offending team and what they do in terms of diversionary work with UKSA, I think we mustn't lose sight of that whilst we do have a lot, it's trying to make sure we reach out to those people who wouldn't naturally join, can't afford to join, can't, all of those aspects.
I agree that with travelling and the cost of buses and stuff like that for them to get to different places. Councillor Andre?
Thank you, Chair. Just indulge me, I do have to come in there just to highlight our Connect for Communities and Holiday Activities and Food Fund, which is operating, which offers 4 weeks of activities throughout school holidays, which I'm sure you're aware, which was specifically targeted at children on free school meals, but not solely, because once we knew that we had those covered, there were places offered, and we worked very closely with the schools to identify that specific group that could benefit from those from the Holiday Activities Fund.
That's good. We're all working for the good of the island. That's the most important thing. Okay, are there any further questions? No. Are there any members' questions? No, I've allowed you to speak during the meeting, so that was good.
I think we may just want to formally agree the recommendations on the Energise Me. I don't think anyone's going to go against it. But
Yep, sorry, ladies, we do need to formally agree that. Are all those in favour that we do formally agree? Yep. Anyone? Right. Superb, thank you very much. And as there are no questions on number 11,